Welcome to this episode of Reimbursement Readiness, Business Tips for Wound Practice, presented by Kathleen and friends. As promised, Amiee Coriano has joined us today to provide the facts about correctly billing Incident to services. Welcome, Amiee, and thank you for joining us and for sharing your expertise.
Morning. Thank you. I'm glad to be here to help you guys with this Incident to billing services today. In this episode, we're going to discuss the Incident to services, review who can provide Incident to services, summarize the requirements of the Incident to servicing provider, explain Incident to documentation requirements, and review Incident to billing tips and Medicare payment. Our first thing we're going to talk about are what are Incident to services. Per CMS, Incident to services and supplies are those provided as an integral, although incidental part of the physician's or non-physician practitioner's personal professional services during diagnosis and treatment. Some examples of covered services included evaluation and management, minor procedures, and medication management that meet the Incident to criteria. Qualified healthcare professionals who can provide Incident to services. QHPs can either provide services without direct supervision and bill Medicare with their own NPI, or provide services that align with the Incident to rule and bill Medicare in the name of the supervising physician. The nurse practitioners, also known as APRNs and ARNPs, have the authority to assess, diagnose, treat, and prescribe medications for patients and provide primary, acute, or specialty care in various healthcare settings. These QHPs specialize in a particular patient population or a skill set. Physician associates, also called PAs, are licensed medical professionals who provide care. They diagnose and treat illnesses, perform minor procedures, and work with patients of all ages in various medical settings, including hospitals, clinics, physicians' offices. PAs practice medicine in every specialty and setting. Now, the requirements of Incident to supervising physician. The supervising physician must perform the initial service, which is called the E&M, and remain actively involved in the course of the treatment, including creating and updating the plan of care. The supervising physician must have qualifications that exceed those of the QHP receiving the supervision. Physicians can only supervise professionals within their scope of practice, and the supervising physician must comply with the state regulations regarding the number of QHPs that he or she can supervise. The supervising physician also must be present in the office or the clinic and be immediately available to provide assistance and direction throughout the entire encounter. The supervising physician must be in the same location as the QHP that they are supervising, and they cannot be on vacation, in surgery, or in a different location. Some variants to this rule may exist for teaching physician services provided via telehealth, so please check with your states. Now, for Incident to documentation. Documentation must describe the supervising physician's involvement. The physician created active treatment plan and that the physician provided direct supervision. Documentation must include the name and credentials of the QHP providing the service, proof that the Incident to service was provided to an established patient and was a continuation of the physician's established treatment plan, and proof that the QHP services was supported by the physician's involvement within the patient throughout the course of treatment. Now, some tips for the place of service. The service billed Incident to must take place in a non-institutional setting, which the Centers for Medicare and Medicaid Services, also known as CMS, defines as all settings other than a hospital or skilled nursing facility. The office, which is a place of service 11, qualifies for Incident to billing. Now, please note, If a QHP works in a private practice and sees patients in their home, this does not qualify for Incident to billing. In this case, a QHP would have to bill under his or her own NPI. Now, there are tips for new versus established patients for Incident to billings, and we're going to talk about that next. So any physician member of the group may be present in the office to provide Incident to supervision. The supervising physician does not have to be the physician who performed the initial patient evaluation. New patients do not qualify for Incident to billing. Established patients with a new problem should be seen and billed by the treating or supervising physician for that date of service. If the Incident to requirements are met, established patients with no new problems may be seen by the QHP and billed with the supervising physician's NPI. Incident to work for the Medicare payment. Medicare pays QHPs differently when they provide services to their own patients than when they provide Incident to services for their supervising physician's established patients. When the QHP provides Incident to services under the supervising physician's NPI, Medicare allows for 100% of the physician fee schedule rate. When the QHP provides service to their own patients and bill under their own NPI, Medicare allows for 85% of the physician fee schedule rate. Please note, to accommodate for a larger patient load, many practices prefer for the QHPs to see their own patients and to bill under their own NPI and receive the 85% of the allowable rate.
Amiee, thank you for sharing the Incident to billing facts. In addition, I personally thank all the subscribers for tuning in to Reimbursement Readiness, brought to you by Wound Care Today USA. Don't forget to stay up to date with the latest insights in wound and ulcer management reimbursement. You can also listen and subscribe to Reimbursement Readiness on Apple Podcasts or Spotify. Simply click the link below to access this and other episodes on your favorite platform. Be sure to like and follow WCT USA to receive the latest reimbursement readiness releases. We look forward to talking with you soon on our next reimbursement readiness episode. Thank you. Have a great day.